Hey everyone, thanks so much for joining me for this week's episode of When I Grew Up. On today's episode, it's my pleasure to welcome my guest, Eddie Lai. Hey Eddie, how are you?
I'm doing well, Blair. How are you doing today?
I'm doing great. Thanks so much for coming on with me today.
Of course.
Yeah, so Eddie actually, we were just talking before the podcast started on how we kind of met each other or even how this happened today, us meeting. Well, Eddie reached out to me and was like, hey, do you want to talk about health administration and stuff? I'm like, what even is that? Yeah, I want to talk about it.
Right.
So Eddie, thank you so much again for taking the initiative to reach out to me.
Yeah, of course. I think my life is a series of random coincidences and connections. So happy that, you as a podcast host responded and gave me an opportunity to hopefully speak about, what brought me to this point in my career and hopefully inspire some people to consider health administration or this realm as a career and or just get understanding for their own life.
Yeah, I am so excited to learn more. I try not to do too much studying before I talk with people because I found that I'm not as a good interviewer unless
Mhm.
if I know too much because then I start to assume things. So just
Mhm.
pretend like I know nothing because I know nothing today.
Sounds good.
Okay, so without, me rambling on some more, Eddie, what exactly is it that you do?
Oh, right. Yes. So what I do currently is I work in Emory Healthcare's Innovation Hub. And so I am a second member of a two-member team officially in the Innovation Hub. We do work with people at Emory Healthcare on the IT side, on some clinical informatics side, different areas. And so kind of just to step back a little bit, Emory Healthcare is located in Atlanta, Georgia metro area. It's a 11 hospital integrated healthcare system, which means academic health system, which means that it has a school of medicine that has different students who are working within various facilities at Emory and elsewhere. It has research, a big research component, and it has the healthcare delivery side. So that side is what you classically think about when you go to the hospital, to
Mm-hmm.
the ER, to surgeries, to
Mm-hmm.
ICU, things like that.
Mm-hmm.
Obviously, a lot of spotlight in the past couple of years because of COVID-19. But of course, hospitals have existed for a while. Hopefully, they will continue to exist in the future, but I do think they are changing. So our innovation team our innovation hub started in 2018, and it was formed with a desire to kind of interface with large companies, large to medium to small companies, but initially with some large partners who wanted to innovate in healthcare. And so when you think about it, it ranges from pharmaceutical companies to insurance companies to medical device companies who want to maybe think about how to validate their products from hardware to software in a clinical setting, but themselves might not have a whole hospital, right? And so they
Mm-hmm.
kind of approach different hospitals such as Emory Healthcare to do so. Now they could do this on a research end, or they could do this on an operational end. And so my job as the Innovation Hub Administrator, I've been in my role for just around a year now, is to help listen to these projects and understand how we actually feasibly do that at a hospital like Emory, because a lot of people have ideas, but not everyone necessarily has worked in the hospital and understands who do you talk to on the IT side, who do you talk to on the clinical side, who do you talk to on the operational side to actually get this done in a way that is both compliant, ethical, and safe for both our patients and providers. But the reason I was able to do that was some of my previous background in health administration on the operations and strategy side when I first came to Emory. So happy to talk about that more later as well.
Yes. Okay. That was a lot of information, Eddie. I'm not gonna lie.
Sure.
But okay. Just so I get a grip on what it is that you do. So what I heard, which by the way, all of it is extremely it sounds very cool because even this the word innovation. Is that what you said?
Innovation.
Yeah,
Yeah.
like I'm like, oh, like so trendy, like this word. But
Good. The people
but
also like, what does it mean?
yeah, like, so I mean, I heard basically you are the middleman for bigger companies trying to implement things into the hospital but don't know how, and you're the person that will probably know how to do it the most efficient and effective way. Is that right?
That's actually a great summary. I am kind of that liaison,
Uh-huh.
and so I help connect them to the right people. So in a way, my functions are to project manage these projects to make sure that everyone on the Emory side is doing things, and
Mm-hmm.
that's getting back to some of these companies or people that we work with. And the other side of that is that with the Innovation Hub being just over 3 years old, helping to program manage the program, thinking about how do we more effectively do these types of projects in a way that will help everyone involved. And so kind of strategizing that area.
That is so cool. Because like those are things that I never think about, but someone has to do it. And that's what I love about this podcast anyways, but is that I people come and share their stories and their jobs, and literally it's never crossed my mind before.
Yeah, and I mean, to that point, I would say that I'm the first person who's ever held this role. Like this role was created, and I took it, and so, and in a way, I don't know if it was created for me, but I know that at one point I asked for a job in this team, and they said no, and then later, a week later, there was then created a job, and I was the first name that came to mind, and so happy to share about that whole process because I think that was a very very interesting process as well.
Yeah, amazing. Can you wait before I ask you about that actually?
Yeah.
So, what does a typical day for you look like then?
Yeah, and this is a very cliche answer in the world of healthcare administration, especially is that no day is the same. But I would say a typical day, I start around 8:45 with some kind of an internal huddle we have with some of the team members that we work with in IT to understand kind of what are some quick escalations that we need to do. Similar to in tech, you hear about stand-ups. Similar to in the hospital, we have in operations world these things called huddles, where the idea is that instead of emailing everyone all day to figure out an answer, you all just go to one big meeting where you talk about all your problems, and then
Mm,
you're like, I have a problem with I don't know, like technology. And it's like, well, the technology person's over there. Go talk to them. So
mm.
it's like, solved very quickly. It's a form of lean methodology, which is borrowed from manufacturing and other things. So I'll have that stand up, talk about any escalations. And then the rest of my day kind of varies between meetings I have with different people within the hospital or externally, those companies I spoke about, their team members or internally. People that we need to touch base with on certain progress meetings or think through how do we functionally do some of these projects. So that's one part of it. The other part of it is kind of tracking down on your classic emails and whatever, just tracking down, hey, where is this thing at, what's the timeline for this, kind of keeping everyone on track because everyone has exactly what they need to do, but they might not know what other people are doing, and they might not have the time or bandwidth to connect with everyone in one huge meeting, we have like 40 people, right? Especially in the hospital admin world and clinical world, especially these days with COVID-19. And the other part is kind of thinking about, okay, talking to people and seeing, what are the problems that they have right now and how do we solve them, and then going
Mm.
out on the internet and seeing what exists already, and maybe who they've worked at with Emory or other health systems, and seeing what's interesting to bring in. So I get a lot of people who reach out just because of the name of my role on my LinkedIn or something, saying, hey, I have this product, I'm interested in
Mm.
working with Emory. And I usually say like, well, show me first. I'm kind of like the gate. Well, I don't tell them I'm the gatekeeper, but I tell them like, I don't make the ultimate decision, but if you have a good pitch for me, then maybe I'll consider. I
Mhm.
will say, I would say my meter for, my meter and tolerance for, companies who actually know what they're doing, has definitely honed over the year, I would say, or over the years. And so you can kind of tell when someone, actually knows what they're talking about, and when someone is just kind of riding the whatever COVID wave or digital innovation wave. That being said, I mean, there's a lot of stuff that sometimes I might not know what to do. So I just say, hey, it seems interesting to me. Talk to someone who's actually an expert in like this specific field of orthopedics or
Mm,
hematology or something like that.
mhm, mhm. Okay, so oh, sorry. I am trying to wrap my head around like your job a little bit more because I really
Mhm.
do want to understand it.
Yeah.
Um, well, okay, the first thing that I wanted to ask you was, you mentioned like they want to show you their product, but I'm confused by that. What does that mean? Like, can I get a real live example?
Yeah. So product can vary between, hardware. So like a medical device
Okay.
or a software. So it's easier for, especially on online, to show a software because they can just share their
Mm.
screen and say like, this is how the software works. This is what it would do. This is what it would integrate with.
Like
And
for
then I will just,
example, like a software would be like for maybe like for nurses to use or something. I
yeah,
don't.
I'll give an example. So let's say they have a product that helps schedule nurses more using AI, right?
Okay,
They'll show
okay.
like, okay, I have a list of nurses in this unit that usually someone would manually just go down the line and say, oh, we need nurses. Like this person called out, we need to go down the line. But then the and then you have to cross reference like paper calendars or something. But
Mm,
they said
mhm,
like,
mhm,
oh, our product will use AI or whatever to smartly understand who can, work right away. And then they'll show me, the mobile version, the desktop version, and I'll ask questions like, well, what if this happens? Or like, who have you worked with before? Or like, how did you come up with
mm.
this idea to
I
understand kind of both their
see.
motive, and I'll ask like, what is your business model, right? Like, will we subscribe to you? Is this a one-time payment? Because that's also important. And the idea is
Mm,
for me to get all the information so I can think like, okay, is this a good product? Who should I talk to at Emory that would know more about the nuances here, or that? But then I can still speak to them saying, hey, I came across this product because they know me personally, and I'll be like, I know this product. They seem good to me. This is what they're doing. This is what I've posted them. This is what I think might be good about it. This is what I think like they need to explain more. So that's kind of what it is.
so you're kind of like a merchandiser for the health industry.
Um, I don't know what a merchandiser exactly is, so I
Sorry, I
don't know if I
just
can answer.
it's like, like in the fashion world, if you work for Nordstrom's, you decide what products come in and don't come in. And then like you okay, that sorry, that clicks in my mind.
Yeah, well, if you put it that way, I would say to a degree, I
Uh-huh.
think that
It's just one of the things maybe
it
that you
is
do.
one of the components.
Yeah.
That probably is more, I guess, interesting to people. But I think that I have some inputs and I bring it to the people. That doesn't stop people from, in your analogy, reaching directly out to like Nordstrom's themselves. But
Sure.
again, those people might not have the time to kind of think through it because they're just trying to do their normal day job, right? But my
Yes.
day job is partly to understand this and to do this. And so I'm always like on LinkedIn trolling around for the latest trends,
Oh.
on Twitter looking at different doctors, seeing what they're seeing. So I have a bunch of podcasts and things that I'm subscribed to and newsletters I read.
That is really cool. Man, okay, so oh, another thing I wanted to ask was so again, just for like a better understanding and clarification for myself,
Mhm.
um, could you give me an example? Like, I don't even know if you can actually tell me this. I don't know if there's some sort of legal like thing you're not supposed to say
Sure.
anything, but like of like, where you felt your job, like you were in the right place at the right time. Like you felt like, oh, this is why I'm doing this. Do you get what I'm asking you?
Yeah, I hear what you're saying. I think for me, I can speak to times in my previous roles at Emory when I first came that
Mm,
that definitely like resonates, and that's when I was more health, hospital administrator, as we were kind of talking about earlier before the podcast. I think right now I'm actually actively um, I feel really good about this one company. I'm not going to say the name. I'm not going to
yeah,
say
don't say
exactly
the
what they
name. Don't
do.
say it.
But yeah, I know. No copyright or whatever. But um, I've talked to them in varying degrees, and I felt that they were very promising. And I actually feel that if they do it right and they do it effectively, they can really change healthcare. Right? It's not
Mm,
very often that I feel this way about certain companies, and so um, and the reason I felt like it's the right time, right place is because um, actually right now Emory is going through an internal electronic medical record change. And
mm,
so if you're familiar with hospitals or anyone who's listening, is that electronic medical record, for better or for worse, mostly for worse for if you're on the clinical side, is kind of the backbone of the hospital operations side
mhm,
because
mhm.
it captures kind of the schedules, it captures how we do things, the notes that people are always typing up when you go to the doctor's office. Those are all captured in the medical record. But with that comes a lot of excitement about a change, but also kind of opportunities to potentially introduce new changes. So that's like part of it. But the other part is that as we go out to hear about the problems that our clinicians have, whether that ranges from primary care to cardiology to whatever, we're finding that a lot of the challenges that they have uh, could potentially be addressed by this software that I've been talking to. And I happened to come across them from LinkedIn, and I connected with their CEO. And so it just so happened that like as we're hearing these problems, I'm talking to someone who might have a solution. And not to say that they're the only solution to the problems, but they are one of the more promising ones I've seen. So in that sense, if it happens to go through, I can probably look back and say, wow, I like brought that to a health system and
Yes.
hopefully save some lives, right?
Yeah, yeah. Oh my gosh, that's incredible. That's gave me the chills.
Yeah, that's the hope. And it's one of those things where, I'm not a clinician, so I'm not saving the life, but the idea is hopefully that the work I do or am involved with can impact a lot of people down the line.
Sure, sure. Yeah, man, that's crazy. So you were saying that you felt like this position, coincidentally opened up after they said that they didn't have a spot open. Could you tell me more about that journey and how you got to where you are in this job?
Yeah, happy to do so. I'll overlay this with that. I feel like especially in my post-college life, well, both in my college and post-college life, I've learned to just go for things and ask for things. Um, and that has and it's a little bit counterintuitive to how I kind of grew up or was raised or as a child was, but I think a lot of us kind of grow in our confidence in ourselves and boldness, and so I've kind of found that the worst case that could happen would be like no, but the best thing that could happen could be something great, just as like
Mm-hmm.
this. And so just to overlay kind of some history is that I moved to Atlanta, Georgia to work at Emory Healthcare, which is where I still work right now, in 2019 as part of this program called an administrative fellowship. Now, what that is in English is it is kind of like a leadership development program for people interested in healthcare administration in hospitals. And so, if you think about another word for them are administrative residencies. So you can equate that to if you know about medical residencies, excuse me, who for people who just graduated medical school who are now residents and learning from different leaders and different they're attending doctors or nurses or whoever to learn how to be the future professionals of their hospitals. Similarly, these programs are helping develop people who are coming from Master of Public Health, which is my background, Master of Health Administration, MBA in healthcare, whatever it is, who are interested in working in hospitals and becoming leaders in hospitals. So that's how I initially came, and maybe it was within our first couple of weeks we meet with all the leaders of the hospital system, and so maybe week one or week two we met with who now is my current boss, who's the director of our innovation team, and I totally geeked out. I was, there was four of us in the fellowship program. We're all together all the time, meeting different leaders, and met him, and I said, "Oh my gosh, like this is exactly what I want to do. This is what I've been
Mm.
interested in since grad school, and the intersection between healthcare and technology. I never fully wanted to be, a CEO of a hospital or COO of a hospital. I mean, those are great things to do and great impact, but my interests were always kind of more on the data technology side. And so I told him like I would love to work for you, or I would love to work on projects with you. And he said, right now we're still trying to figure things out. But let's keep in touch, right? And
Mm.
so what I took that to be as is was every couple months I would just email him saying, "Hey, any jobs, any projects?" And he would always say no. And he said, "We should meet up though. Like, let's think about if you were to want to work for me, like what you should do in your fellowship
Oh,
to do so."
interesting.
Right. And he would tell me like, you should work on these kind of projects if you can. You should talk to this guy or that person. And so that was helpful. And so even during my fellowship, anytime um, projects came up that had to do with innovation or technology, I would always volunteer, even if they weren't in my original kind of projects I was doing. I would always be like, "Hey, is there any way like I can get involved with this?" Similar to your point, my point earlier on, kind of just asking for things. I would, they would let me. We have this thing that we do in the fellowship, which is capital budgeting. So every year we are budgeting for the entire fiscal year. Allocation of money that can go to
Sure.
construction, that can go to whatever. I volunteered for the technology one because I was like, that's what I'm interested in. So fast forward, fellowship program is 2 years,
Mm.
and during my second year, I ended up kind of taking more of an interim role at our vaccine clinic, which is a whole nother story of where I was working crazy hours. And I think for better, for worse, the better part is that I think a lot of the senior leadership noticed that I was like working very hard,
Mm.
because that was like our big thing. And in fact, people I know got their vaccines at our clinic, which is pretty cool. And so um, during that time, I was also thinking about what to do after my fellowship. So I was looking at different jobs, both in and out of healthcare, both in and out of Emory as well. And one day, what happened was I just so happened to run into my boss getting his second dose of the vaccine at the clinic, and I was like, "Hey, like, how are you doing?" He's like, "Oh, good. What are you up to?" And I go, "I'm looking for jobs, actually. Do you have any?" He says, "Let me think about it and get back to you." And what happened was, I can't take that as a guarantee. So I was still applying to other jobs. And I ended up getting a couple of job offers, which was great. But I was still interested in this job. And then what happened was one day he calls me, he goes, "Can we have a call?" And I'm like, "This is it. This is it." And we call, he goes, "Where else are you applying?" I'm like, "I'm applying here and there." He's like, "Oh, you should take that job." And I was like, "Well, what do you mean?" He goes, "There's just nothing for you here right now." And I go, "Oh, that's not how I thought this call was going to go." He's like, "Well, see me as like just a mentor type figure, just giving you advice." And I was like, "Okay." Um, and so, I continued to apply to other jobs, and I had offers in hand that I was days away from accepting offers to, right? And then he one day texts me, he goes, "Hey, do you have a second? What are you doing right now?" And I was like, "Nothing. I'm finishing up closing clinic." And he goes, "Let's chat." And he goes, "So I changed my mind. And we have a new role that I helped create. And the first person I thought of was you, not part to the fact that you've been bothering me for the past 2 years." And I was like, he's like, what will keep you from taking this job? And I said, "Money." To a degree. And he said, "Well, what are you looking for?" And I said, I just gave an amount that was more
Mm.
than all the other offers I had together so far. And he goes, "Yeah, I think I can make that work." And I go, "Oh, okay." And then we kind of fast track, next day I talked to HR, next time I talked to his boss. And then I had an offer standing by that following Monday. And so I ended up, taking my other offers and, telling them no. And so what I learned from that is that you're probably getting this too, is persistence is
Mm.
in a way that is not too annoying, but also showing your desire actually pays off sometimes.
Oh
And the
no, I feel like a
timing just
lot of
happened to be,
times, a lot of
yeah, and the
times it
timing
pays
happened to
off.
be just really good too, I think.
Yeah, I mean, sure, being persistent is helpful and it does pay off, but there's no doubt in my mind, Eddie, that you were probably um, doing things to make yourself worth making the job position
Sure.
open. You know what I'm saying? Like, I'm sure
Sure.
you proved yourself worthy of this position. So, I'm sure it's just more than just being persistent on your side.
Yeah, no, that's true. That's true. I mean, I always think of this quote, and I'm probably gonna butcher it. I'll have to Google it later, but something like, I forget if Tom Brady said this, but it was something like luck is when preparation meets opportunity.
Yeah.
And
Yeah.
so I would say in my career, I've been lucky, but I have worked hard, and I have kind of prepared myself in ways so that, when opportunity comes, hopefully it's, right time and place.
For sure. Now I have to ask, like, in how does one get inspired to go into health administration? Like, where did this
Ah,
all start?
yes. I would love to take some time to later on in this talk about the work we're doing in my group, the Association of Asian Healthcare Leaders, because that's why I started that group in the first place. But
Okay.
I started my kind of journey in healthcare into this path um, kind of in high school. Obviously, my parents immigrated from China. I was growing up. There was like, you got to be a doctor, you got to be an
Sure.
engineer, you got to be a lawyer. And in fact, I was president of our Future Engineers Club at one point, but then I took
Makes
physics, and
sense. Yeah.
I took physics, and I said, never mind. I don't want to be an engineer. Um, but
And where did
what
you grow up again?
I grew up in New Jersey, South
Okay.
Jersey by Philadelphia, and that's why I ended up going to college. But before that, my family moved around a lot, being immigrants, and my dad was in school and stuff. And um, so what attracted me to healthcare was that when I thought about what I wanted to do was basically help people. And to me, healthcare was the most tangible way you can help people, right?
Sure.
You come with a scratch, put a band-aid on it. Wow, change your life to different degrees. So I applied to colleges, pre-med, as well as ultimately where I went to school was pre-PA. And so pre-physician assistant, which I know you've
Yes.
had some folks explain what that is and what that looks like. And so I was on an accelerated program at Drexel University in Philadelphia, where it was kind of a 3+2, which is not uncommon in these PA programs to do. And so my plan was to graduate in 3 years, and then do PA school for 2/3 years, and then become a PA. Freshman year, things kind of, the transition was kind of rough. Things in my life was kind of rough, and ended up actually failing out of that program. Not failing like F, but like I got a grade that was lower than the threshold you needed.
Mm-hmm.
But I said, I still want to do this. I'm going to keep pursuing it. And it wasn't until um, my senior year where I picked up a minor in health administration, which is kind of where it starts coming in, because I figured if I'm supposed to be in the clinical side, I should know about the business side of healthcare as well. And so
Mm.
I took that. But it all kind of converged together my senior year, where I finished my co-op program at Drexel, where we worked, in the workplace. And so I did an internship as a therapy aide of sorts at a health system. And I was doing everything from helping with therapy, doing stretches with people, throwing balls, to cleaning up pee, right? Stuff like that, clinical stuff. And I was thinking in my head, do I want to do this for the rest of my life? I'm not
Mm.
sure, right? Obviously, appreciate the impact, but I'm not sure if I want to do this for the rest of my life. And then I was finding that I really liked my minor, which is really great. And then the last part that kind of propelled me to the path was uh, there was actually this girl I was interested in, and she was studying pre-public health. And I was like, I don't even know what public health is. Tell me about it, because I want to talk to you, but also I do want to learn. And she told me, public health is about the, understanding the factors of people's lives that affect healthcare and their health that leads them to the hospital. Because if you think about hospitals, they're almost like, and this is an analogy I've heard by the dean of my public health school, is that they're like the goalie, right? But there are so many factors, including offense and defense, that happen before you even get to the goalie, and the goalie can only do their best to stop it, right? So if
Mm-hmm.
you think about public health, it's all we call it social determinants of health, things that affect your life, your health in your life, that will get you to that, your
Mm-hmm.
access to food, your access to housing. And so I said, this is actually super interesting.
Mm-hmm.
And I think my personal skills in, maybe communication or organization might fit into public health and or health administration. And so ended up graduating, and not knowing what to not knowing what to do with my life. So I ended up working um, in a high school in West Philadelphia for a year. In
Sorry,
fact,
just real
yeah,
quick. So you graduated with a degree in what then?
my undergrad degree was health sciences, which is kind of the default degree for people pre PA,
Okay, okay,
with
okay.
my minor in health admin.
Okay,
And
and
so
with your
I
minor in
tried
health admin.
exactly. So
Okay.
I tried to apply to health admin roles, but found that it was very difficult. Someone who didn't have a major in that, and also that a
Oh,
lot of the roles in the field are master level entry, depending
I
at
see.
least the well-paying ones, right? Besides
Okay.
being like a medical biller and things like that, which are all still great experiences and roles. Um, so in frustration, during applying to those jobs, said, I'm just going to apply to grad school now because I was going to wait a year. But I said, I'm just going to do it now and see what happens. So I kind of rushed everything through my recommendations, letters of yeah, taking the GRE, things like that.
Hmm.
And then as I waited, I took a role in a school in West Philadelphia, working with high schoolers on tutoring and, college readiness. Um, and during that time, what also helped me to go this career was I just didn't see many people. I didn't know about this career, obviously, until I talked to or this field until I talked to that girl. But then also, I didn't know if you could actually get a job in this field. And what helped me
Hmm.
was some people from the church I went to actually got their master of public health and were consultants and successful. And I said, "Oh, so this is like a thing. Like you can actually get this degree or go this path and like be successful." And so
Right.
that really helped me because I just didn't have any older role models, right? Everyone I
Hmm.
knew became like a doctor or something.
Sure.
And so or maybe I just didn't know many people, I don't know. But that's kind of how I initially got into it. And then when I went to grad school, kind of the rest is a little bit history. But later in the line, I started this group called the Association of Asian Healthcare Leaders because I wanted to reach out to people like me who didn't even know this was a field and just explain like my path like I'm doing now, but also explain, if you want to become this is one path to do it. This is another path. You probably have to get this degree, or you can go this path, and that could lead to it too.
That's amazing. I mean, literally, I'm like, as you're talking, I'm like, man, my eyes are just being open to
Good.
like different opportunities that I'm sure a lot of people have never thought about. Just like when you talk to that girl about public health and stuff. I mean, I do know a few like people in my life that are in that industry, but they're much older than me. And so like I think they've been in it for a while, but thinking about the young people I know today, like I don't think this is even a consideration, honestly, but in an option in someone that like, yeah, I know a lot of young people that are considering going into the medical field because of the
Yeah.
same reason you said. Like they want to help people, they want to serve people and help them feel, make them better and to give them quality of life. But wow, what a interesting opportunity for you to do the same thing, but differently. You know?
Exactly. And I would say if you look at people who have gone this path, a lot of them start out pre-med,
Mm.
pre-whatever, and they kind of change course. I talked to, oh, go ahead.
Oh no, go ahead. You talk to it. Yeah.
I talked to a lot of people who are, sometimes they say, I was pre something, but now I don't know what to do, but I don't know if it's like
Mm.
too late. Like, are there other paths? And I was like, well, I was exactly that. And,
Mm.
I mean, it took a couple years, but I would consider myself, doing well now. And, what I encourage them, if you want to pursue this path, like there are tons of people who have gone it and are successful. And because sometimes people say like, I feel like I have to be like a doctor, I have not to say
Mm.
that those people should give up. I said if you really want to be a doctor, like you should go for it for sure,
Right,
like do
right.
whatever you need. But if you are kind of iffy but still want to be in healthcare and like are good at business and stuff like that, like consider this career.
So my one question I had was, so is it beneficial for one in health administration to like know medicine?
um I would say yes. I would say definitely to a degree. Obviously, you don't have to go get your MD or your DO or your BSN. But if you think about it, you're interfacing with doctors and other clinicians all the time. So you want to know something about what you're
Mm-hmm.
talking about, right? Especially in clinical operations. Um, so, it was helpful for me to kind of have some context from my educational background, but obviously I didn't go get my MD or anything. So I actually think in general, people should know about medicine because that's their health.
Yes.
But it is important to know a degree about kind of medicine to work in the healthcare field, even though
Okay.
you're not a doctor.
Right, right. And sorry, so you did go to grad school or you didn't?
I did. So I ended up in that gap year. I worked in West Philly, and I ended up getting into a couple programs. So I got my Master of Public Health in Boston University.
Okay, amazing. Wow, Boston University. Man, you're just really smart on top of everything else, huh?
No, just luck.
um,
Yeah.
but okay, so say a high schooler is like, this is interesting. Maybe this is something I want to do. Like so what you're telling me is that at certain colleges there are like health administration tracks for people.
hmm That's right.
Mm.
So in fact, I actually reached out to my alma mater high school because they have like a health club, and
Uh-huh.
I said, "Hey, I'm an alum, like class of 2012. It's been a while. In fact, my 10-year reunion email just came up, and I was like, "Wow, that's crazy." But I said, "Hey, I would love to speak to high schoolers to talk about like my journey." So to your point, to your question, there are some colleges who have very robust healthcare administration programs. Well, I'm not sure if I'm allowed to give shout outs, but
You
um,
can, yeah.
there's a program in University of Texas at Dallas. From what I've seen from kind of our organization, we see a lot of engagement from people who either are there right now or have gone there for undergrad and went to graduate programs across the country.
I see.
So I wouldn't say every school is created equal in their undergraduate program, but there are ones that really set you up for success. Um, but you can also major in other things and still work in healthcare. You can major in business, you can major in nursing and go with the health admin route. So to your question, yeah, I would tell that high schooler, if you know you want to do healthcare admin, I might consider some of these colleges that are good at it.
Mm-hmm.
But I would also say that you can also get into this field with a diversity of experience, and
Okay.
you can go to a good master's program.
After college, even if
Exactly.
that's not what you studied.
I would say, yeah, I would think at least for the master of public health, um, they're pretty holistic in the way they take admissions. Obviously, like you have to have interest in healthcare
Yeah.
and probably a little bit of healthcare experience here and there, but
Okay.
yeah,
It's not too late, people.
it's not too late. No, no.
um, you were mentioning, I think maybe before we started recording that, are there a lot of Asian Americans in health administration?
No. So I'll give an example. One of the reasons that I spoke to earlier, I didn't know to go this path because I just didn't see many people who looked like me or had the same cultural background as me who did this path. And it wasn't until I met some people and I said, "Oh, okay, like they did it. Why not? Why
Mm.
couldn't I do it?" So when I went to grad school, I was pretty cognizant. I looked at my classmates. Actually, my classmates were pretty diverse, but within public health, you can go a lot of different routes. You can go epidemiology, you can go biostatistics, but within healthcare management, um, I didn't see as many Asians. And so, as someone who's keenly aware that they're Asian American, I'm definitely always kind of like looking out. Um, and so one of the things I did was I joined this professional organization that happens to have an Asian forum or chapter. And one thing that was interesting was that as a student to join the national org, it's $30. To join that Asian healthcare chapter, internal to that org, was $100. So it was weird. And I was like, why is this so much more expensive? I'm like a student, but why is the subgroup more expensive than the main group, right?
Mm-hmm.
But I was there for 2 years in that group, and I just didn't find much value.
Mm.
I didn't find much. And to be fair, like maybe I should have applied myself more. I was very busy, but I just didn't find much value. And so, when I especially noticed that once I went to Emory. Now, Emory's great org, great people, but I did find myself in a lot of these executive meetings with really high level folks. For me, not to be the only person of like not the only Asian, but also the only person of color sometimes, right? That wasn't clinical. And not
That's
I don't,
interesting.
and I don't think this is a reflection necessarily on Emory, but I think this
Right.
is, if you look at healthcare administration in general, I would say I would say, and people would agree with me, that the standard healthcare administration candidate is probably like a blonde white woman, right? Um, from the South. Like that's just like the demographics I've seen. I mean, great people, of course. And so I definitely became super aware of that, right?
Mm.
And that's why I started our group, the Association of Asian Healthcare Leaders. I co-founded it once someone, and I can talk about kind of that formation story. But we've grown from 3 founding members to we just hit 1,200 members the other day, which is cool.
Amazing.
Mhm.
So, like as this group, like so you guys just kind of support one another, or what is the purpose of it?
Yeah. So just real quick, the origin of what happened was during right after the pandemic started, a student reached out to me and she said, she was a student who was working at the time as well. She said, "Hey, I came across your profile. I see you're very active on LinkedIn," which I'm annoyingly active on LinkedIn. She said, uh, "I don't see many Asians who are in healthcare. One, two, I don't see many Asians who are in healthcare who are active on LinkedIn, who are younger
Mm.
careerists, right?" And she was like, "I'd love to connect." And I was like, "Yeah, sure." And we chatted, and then I said, "I completely agree with you that I don't see many Asians in this field. Like, even in the group I've joined in the national org, I just didn't see much engagement." And we said, "We should do something. Like, we should like form a group. We should do an event." And we kind of went from there. Um, and what we did to kick off our group, and this has kind of been the staple of our kind of programming in this group, was to do a webinar event on administrative fellowships. So that's the program I was telling you earlier that I was in, because you see a lot of these programs, because they're pretty, I'm not trying to toot my own horn, but they're pretty like prestigious programs, like pretty
No, it
coveted.
sounds like incredible. I'm like, and I'm assuming there's quite a lengthy interview process and like a lot of
Yeah,
screening and stuff. So, like, truly, I'm like in awe of everything you've accomplished thus far. But yes,
appreciate it.
continue. The webinar
But yeah, the
itself.
webinar. So we wanted to do the program, and um we there are webinars that exist like this, but what we wanted to do was kind of do Asian faces in healthcare places, where we featured an exclusive
Asian
like lineup.
faces and healthcare places. That's cute.
um Exclusive lineup of like Asian Americans or Asians in this space. And so we actually approached the Asian healthcare group that I was in, paying $100 to a year, and they basically shot us down as a partnership opportunity. And we said, okay, well, we could either like just be sad, or we could just go rogue and do our own thing. Because like, what's stopping us from just having a Zoom call, right? And like
Hmm.
featuring Asians in healthcare.
Yeah.
And so we just made our own flyer and spread it out on LinkedIn. We had nearly 300 people register. Um, and so clearly, like it was, and that's not only it's not only for Asians, right? Anyone who's interested can join. But our intent was to really show that there are Asians who like went this path and were successful, and you can do it too. Um, and so we had the first event, and then we kicked off the group. And the intention of the group, to your question, is to both support people to be able to, if you join the group and you're like, I want to work in California at this hospital, and you can like
Mm.
kind of scroll in the group, be like, oh, this person, like let me talk to them, right? Because otherwise you like
Mm.
looking all over LinkedIn, Google, whatever. That's one we would love to be like the central place people think of when they think of Asians in healthcare business specifically. Um, and so that's one aspect. But the other aspect is that since then we've done panels on fellowships, internships, consulting. We just did one on data analytics. We've done ones with educators who are Asian program managers of healthcare administration programs. Those are like very rare to find, because it's Asian healthcare administration and education, right? Those are like
Okay.
the most narrow circle there. But we do that, and we do networking. And every time I go to a new city personally, I'll hit up. We have a group me, and I'll hit up the group me saying, "Hey, I'm going to DC. Like, let's meet up." And then I'll just like get together with a bunch of people for the first time. And because we've engaged in the past, it's almost like meeting old friends, right?
Yeah,
Except I
yeah.
met them online.
Oh, wow. What an amazing resource.
I know. So, when half my camera roll is me trolling around on LinkedIn and finding Asians who work in healthcare spaces and just screenshotting that so I can add them later on my desktop.
That's amazing. Wow, I can tell you really have a heart to like really champion Asian Americans in healthcare. So I'm like so like guys, this is what a great resource. If you're interested, I'm assuming anyone
Yes.
can just kind of look into it, right?
Yeah, so we would love to have one day have a website. So we don't have a website yet. We're working to become a 501(c)(3), I believe. So
Amazing.
nonprofit, which I don't know if you people listening know, but there's some paperwork involved and it takes a while.
It's so
Um,
intense to be a
yeah.
501c3.
The other piece is that so our main community we consider is our LinkedIn group,
Okay.
which that figure, the 1,200 figure, is the membership of that group. And so they can just look us up on LinkedIn. We utilize some Asian pages on Facebook with Asian groups called Subtle Asian. Well, it used to be called Subtle Asian Networking, but now it's called Rise. I'm not sure what it stands for. We have a good partnership with their leadership, so they help post our events so that people who are just on Facebook casually like, oh, I wish I'd do with my life. Oh, look, interesting event, can find us as well. And we have like a people who go to our event get added to our email listserv where we send out kind of new updates and things like that.
Oh, awesome. Man, okay, so you guys check it out. Um
Yes,
what
we'll
it,
drop the
so on
links.
LinkedIn they just type in what?
So on LinkedIn, what they can do is type in the Association of Asian Healthcare Leaders,
Okay.
abbreviated as AL or AAHL. And what will come up will be two things: a company page that you can follow, which is fine. We post some updates there, but the more engaging part is the LinkedIn group that you can request to join. And once you join that, you can see all the members who are in there, as well as different posts. I'm oftentimes posting job listings I'm finding. We've had recruiters, come to our page and say, "Hey, I'm hiring for this role." In fact, one of the job offers I was talking about earlier came from someone who posted on our page.
Oh my
So
gosh.
without, I almost manifested my own destiny by making the page, right? Yeah.
That's pretty cool, man. Okay, so I have to ask you, going back to your job, as man, I forgot the title again. Innovation. What did you
Innovation
say?
Hub Administrator.
Sorry, Innovation Hub Administrator.
That's right.
Um, how did COVID affect? I mean, you started in 2019, right?
Right. Right.
And then the pandemic hit. Like, what part of 2019 did you start?
So I started July 2019. So, it was basically 8 months.
7 months, maybe.
Right.
You were there.
Right. Um, yeah, so that wasn't in my current role, but in my previous role as a fellow, it definitely totally changed things, right? Turned things upside down. Uh, our fellowship program, what the way it works is that we get matched up with a preceptor who is interested in working with a fellow. It's also good for them because the way our structure works is that they basically get a free resource. They don't have to pay for a full-time employee.
Mm-hmm.
So they have these bright and bushy-tailed people
And
who want to
eager, yeah.
eager to like do work right in their first job of their career, really. And so I worked in quality, and so I was working on different quality projects, process improvement across the hospitals, things like that. And then what happened was COVID hit. I thought I had COVID, so I like stayed home. I didn't have COVID in the beginning; it was fine. But like at that point, any sore throat was like, "Oh my god, this is COVID."
Yeah, of course.
Um, and to be fair, now with Omicron, like any sore throat could be COVID.
No,
but
absolutely, yes.
um, but with that, what happened first was that my one of my preceptors came to me saying, "Hey, we really need some help. Um, everyone and their brother knows someone who has protective equipment, gowns, gloves, whatever, who want to either sell or give it to us, and they don't know who to talk to, so they're just emailing all their doctor people who are also really busy, right?
Mm.
So what we did, what I initially helped starting was helping just contact some of these people so that we can lessen the load on others. But what we ended up doing was making a centralized email address for everyone to forward their emails to, so that we would address them. So I ended up leading a team of around 30 redeployed employees to help address these emails, kind of triage them. And we developed a system where it's like, okay, fill out this form, then we'll validate it in a way or get it organized, and we'll sell it. We'll bring it to the purchasing team, and they will determine whether or not we want to buy this, right? So that's one side. The other side is like donations. So both small individual and large organization wanted to help out in any way they could. You saw the advertisements back then, helping out healthcare people. And so I helped coordinate, some stuff with LaCroix, who wanted to donate tons of pallets of LaCroix, right? Or Cliff Bar, right? But also helped, direct people to our donation center where people could just drive up and, offload things to them. And so I was doing that for a little bit. And then, donations and things kind of died down. But that was really neat because I was kind of working from home because of COVID, because I didn't need to be in the hospital. But depending on the day, I was going to our director of infection prevention's house to pick up gowns to deliver to one of our hospitals at 10 p.m., right? I was getting up at 6 a.m. to deliver a prototype gown to a clothing manufacturer who wanted to help make gowns. I was talking to a theater company who wanted to use their seamstress to help make reusable gowns, right? So every day was like very different, right? It was really cool. Helping coordinate iPad donations. So I moved from that to my second hospital, which was more focused on, I wanted to get the actual fellowship experience of working in a hospital, nitty gritty hospital. And so I was doing that, but obviously COVID affected all operations there, right? And so a lot of my projects were around, what do we do if we run out of beds in the hospital? Do we open up the dining room? Like, do we put like stretchers in the cafeteria? Like, what if it gets that bad? I remember being on a meeting in my fellowship, maybe like February of 2020. And there was a meeting. They're like, okay, if a patient with COVID comes to our hospital, we're going to put them in the Ebola room, which actually, fun fact, Emory University Hospital, being so close to the CDC, is the hospital that treated the Ebola patients back in the day when they were in the US.
Oh no, I
So,
remember clearly.
so
There
we
was
so we had
two or three of them or something.
exactly,
Yes.
yeah. I actually saw them speak on the reunion a couple years, like,
But has it been a long time? I feel like that was like so
I think it
soon.
was 2014, and so 2019 was a 5-year reunion.
Oh my gosh.
Um,
If I felt like that was not that long ago. But anyways, keep going. Yes.
Right. So I remember being in a room where they were like, okay, if a COVID patient comes, they're going to go to the Ebola room. And then someone goes, what if we run out of room in the Ebola room? And they're like, okay, we're going to put him in this like negative pressure room that's like
Oh my
sealed off, blah, blah, blah.
goodness.
And then someone goes, what if we run out of room there? And then someone goes, then we're screwed. Then like it's basically in the community. And then,
I see. Yeah.
2 weeks later, here we are, right?
Yeah.
And
Yeah.
so, I mean, we can all kind of empathize with how quickly lives changed.
Yeah.
And so, being on the hospital operations side was cool. And then what happened was we started hearing about vaccines, right?
Hmm.
And so, me being who I am, I guess, I sent an email to our director of pharmacy, who basically during this time, Emory had what we call Incident Command Center, which is kind of like the war room, right? So
Hmm.
every day at 10 a.m. and 5 p.m., they had the ICC calls where all the leaders across Emory would come together and give updates like, okay, how are we doing on ventilators? How are we doing on this, that, or the other? And then just kind of addressing as needed. And so every so often, our team would get shout outs because we were like, hey, like the procurement team helped, or the donation team helped get these or like work with these. So like kind of kudos time. But on one of these calls, we heard about vaccines. So I emailed director of pharmacy and I said, hey, as you know, like I'm a fellow, I want to help out. Like I want to learn, like, is there any way to help out with vaccines? And she goes, nope. And I go, okay. 2 hours later, she's like, actually, we might need help. Let me point you to the project manager, who herself was a former fellow as well. And though I talked to the project manager, she goes, I don't think we really need help right now. So I said, okay, let me know. And then 2 hours later, she comes back. She goes, actually, we do need help. We would love some help thinking about how do we staff a vaccine clinic? Because usually when you think about a hospital clinic or outpatient clinic, you hire staff to do that, right? We don't have the time to do that. We need
Right.
staff ASAP, right? So how do we how do we get staff in a way that is effective and quick and safe, that we don't need to like hire new people all the time. And so I came up with that idea using actually Sign Up Genius. You might be familiar with it
Oh
if you're
yeah,
using
I know
Apple
Sign
on phone.
My preschool, my pre-K uses that.
Exactly. That's what it's usually used for, right? I've used it for like volunteer events, right? But what I did was create like a framework to say like, okay, we need 8 vaccine administrators, we need 2 pharmacy prep people, we need X wayfinders, we need these people, whatever it is, like tons of roles, right? And I put it in that Sign Up Genius format
Oh
for
my
each
gosh.
day. And I said, hey, here's my proposal, just an idea. I don't know if you guys want to use it. And then the project team goes, oh, actually, this might work. Let's like, can you present it to the leadership team? And I'm like, all right, if you trust me, I'll try. And then I present to the leadership team. They go, hey, let's do this. And I go, okay. And I'm like, you want to put like the staffing of the vaccine clinic in like my hands? Okay, like I'll try my best. And all during this time, I was just
Did you
like,
staff Stonecrest Mall?
not Stonecrest Mall. I helped do North Lake Mall.
Okay. I think I carried.
Stonecrest Mall was probably the Department of Public Health.
Oh, I felt like it was an Emory site though. I got
Um,
vaccinated at Stonecrest is why. but
oh,
but
we definitely did North Lake.
I remember being super impressed with the whole thing because I
Really?
was like, this is like insane. Like, how did they? I mean, everything was so smooth.
Yeah,
The way everything was segmented. People knew what they were doing. I was so
yeah.
appreciative of
Like
everybody.
you
But
like waited in a certain area. Yeah.
yeah, yeah. But anyway, sorry, I didn't mean to interrupt you.
No.
But
I mean, I wish it was you went to ours. Ours was also very efficient.
maybe I went to
Obviously,
North Lake. I forget.
we'll
It
have
was a
to check on that.
mall.
No, we were literally in a Kohl's, um, like a former Kohl's.
Yeah, like it was like empty space. Like
Yeah, no,
not
that might be ours. We should talk more about that later. Yeah, it might be ours.
okay, but
Um,
anyways.
but I mean, not to say there's not hiccups, right? Like we would learn from our mistakes, but I remember so they were like, yes, Eddie, like help implement this day one where and I was like, okay. We had like a small, night opening on the day we got the vaccines, like finally from the Department of Public Health. And I was literally just sitting there praying that people would show up. Cause like what we did was people signed up, but you know how like it can be like
Right.
people sign
Right.
up, but they don't show up, right? Especially if you think about it, these are either volunteers and or doing it on top of their normal work hours. So like they might be
Mm,
tired. And so I ended up like overstaffing just in case. And then the first night, like they were supposed to come at like X time, and I was just praying. I was like, please show
yeah.
up. Like and they did, right? And then it worked out really well. And they were like, all right, let's do it night 2. And so we kept going through we got the vaccines on like a Wednesday, maybe a Thursday. And then we got through the week. And then what we did was like a 12-hour weekend session where it was like 3 shifts, like
That's crazy.
6 a.m., then 12 p.m., then 9 p.m. And so I helped schedule like each of those. So I was in the background, like making sure, and I was helping like check in people.
Holy
Um,
smokes.
and then every time I was like, please show up, like, please, like, don't. But it was really great because, like, I mean, I think everyone wanted to help out, right? Because everyone finally had some hope that this pandemic might be able to change or end
Yeah,
because we had
yeah,
these vaccines. And so
yeah.
it was really cool for me because I got to see leaders who were, they would come in as CEOs to like, help out, like, just be a presence. But some of them are doctors. So they would be like in the basement helping mix the vaccines. They were helping give shots. Like, I thought that was really inspiring,
I
right?
love that. Yeah.
Definitely like servant leadership. And then we saw people who were like school of nursing faculty who don't give shots anymore, but they were like, I'm willing to help, like I will do this, like I'll help. People who were retired reaching out saying like, I'm retired, but like I want to help the community, like I want to see this end. So that was really like, I'm a little emotional talking
No,
about it.
yeah, I'm
um
about to cry too. I
yeah, so
love that.
it was cool just seeing them. And we had the mall space. The mall by day was our testing center, right? Where we did COVID tests. By night it was our vaccine center. But during
Mm,
the day for actual vaccines, we actually had near the mall a drive-through. It's like a former Sears, kind of like your auto shop, right?
yes, yes.
That
I
we
think I went to that one.
the driving one.
Okay, I don't even know. Okay, keep
Well,
going.
I will say though, a lot of like we had people come visit ours as like best practice to understand like what we did. So I would speak to them like this is how we staff. This is like what we did, right? And so they a lot like people spoke to me from like North Carolina, people spoke to us from all over the country because like we seem to be doing it well.
Man,
Um
Eddie, that's awesome.
and so during those days, we were in the back, outdoors in the rain in the winter, right? It's like
Mm,
January. And so people, I saw School of Medicine students like come and volunteer to be like, giving directions, right? People would drive through and like get their shots and like they would be crying, they'd be dancing, whatever. And I worked with like people to like, get the swag in. Some days we ran out of hand warmers. So I drove to REI and I was like, "Where are your hand warmers?" And they told me, and I was like, "Give me all of them." And then like another time was I went to we ran out of like band-aids, right? And so I went to Sam's Club and I was like, "Tell me what the band-aid section is." And they told me, and I literally I took like one or two, and I was like, "No," I took the entire like little pallet full,
uh-huh,
and I
uh-huh.
just took it out to my car. So like just driving around doing random errands like to get it done, right? Because I
Yeah,
feel like it was very much like wartime effort, like all hands on
yeah.
deck.
Oh my gosh, I love all of this. Like, Eddie, you are a frontline worker. You
In a way, I mean,
No,
helping pay for it.
in so many ways. Like even, from the beginning of just um I mean, from the vaccines and what you were talking about before, when you were kind of seeing everything unravel and like talking about what to do next if rooms were to fill up. Like I just thank you. If no one's told you that, thank you. I'm sure many people have told you
Appreciate
thank
the
you,
thanks.
but
Yeah, it's definitely no. I appreciate that. I think sometimes, people always like to. This is a caveat for everyone who has listened this far and still interested in health admin. People like to hate on health admin sometimes because they're like, "Oh, these people, blah blah blah." But it was cool to be on the ground to see kind of the impact that some of the stuff I was doing, right? And so I was able to say, wow, in a way, like these people are getting their vaccines because of me, because I'm helping create the platform for the staff to come
yeah.
in, right?
No, absolutely, absolutely, 100%. And as someone that like really appreciates behind the scenes, like truly, that's something so simple but no one thought of, and without it, who knows what would have happened. So, really, it's really cool, Eddie. I am so grateful to hear your story and your
Mm.
journey. Um, I we are kind of coming up on our time together. Was there something that you wanted to talk about that I didn't ask you about?
Um, not fully. I would say, in the context of thinking about this podcast, when I grow up, right? What I would love to encourage people who listen to this far is to say that I didn't ever think that I would be where I was. I sometimes think about, if 18-year-old me saw me now, what would he think, right?
Mm,
Because I thought about this when I graduated college, where I was making less than minimum wage, like no job exactly, like whatever, and I was like, dang. High school me would be like, what happened? Like, I thought we got into this program, and I thought you're gonna like become a physician assistant. But then when I think about, 18-year-old me now, he'd be like, oh, this is very different than what I expected, but like it's cool stuff.
yeah,
So I would say that I think like, if you're feeling down in life, like, continue to work hard and, connect with people in a way that, you can look back and hopefully, 18-year-old you or like 5-year-old you would be like, wow, like adult things, very cool. But I think a lot of what I've gotten in my life, a couple of things I've realized is like, I'm just gonna spew out my limited life wisdom is like, um, relationships are super super important. I
mm,
think both professionally, I've gotten all my jobs from, I think like, well, minus the fellowship job, but forming relationships in a way that is, you know, being proactive on my part to understand, how I can support those people, but also thinking about what I want in my career and life, and then kind of taking action. I think a lot of Asian Americans are raised, for better or for worse, to kind of sit in the background and just kind of take what's given to them.
yeah,
But what we see in the entrepreneurship realm and in my experience is that, um, you know, when I've asked for things, yeah, I've been rejected here and there, but a lot of times, to the even the vaccine story, right? I just asked, and they said no to me multiple times, right? But if you just kind of put yourself out there, things can happen. So I've kind of taken that philosophy in different areas of my life. Um, and then the other part I would say is like, um, I think it's cool to be able to for me, it's always about giving back, which is why partly I'm doing this podcast. So hopefully someone can like learn from it.
Mm.
And why we do the Association of Asian Healthcare Leaders is to hopefully give back to the me of, my college time,
Sure,
or the
yeah.
high school me who just had no idea. And sometimes I always think about an exercise we do is like worst case scenario, like what is the worst thing that could happen from this group? I was like, well, I guess the worst thing is like it shut down, but like even if it does, like I made some great friends along the way. I've made some great connections. I've grown in confidence. And hopefully we've inspired people. In fact, um, we just released our inaugural newsletter. And one of the things we did was we featured people who were going into, who are in our group, who are going into fellowship roles like mine
I love
that I
that.
did. And what they did was they spoke to how the association helped them. They said like, oh, without this, like we wouldn't have known about this, that, or the other. I got to connect with all these people who helped mentor me, and it was great because I personally have reached out to a lot of them, give them advice or thoughts. But part of it was like, wow, if we didn't exist, I mean, I'm sure they would have gotten things right, but in a way, like it's cool because we started 2 years ago, and this is like our almost like these people who are getting fellowships now started grad school at the same time we did, and so it's almost like our first graduating class.
Yeah, I mean, it's
um,
truly rewarding, I feel like.
and so hopefully, I went to healthcare to want to help people, and so hopefully like not only through that group, but like not only through my job but also through like the things we did, we can help people. So I would basically say that to encourage people to, if there's a need that you see like available, yes, like there will be someone hopefully to do that, but like why not you, right? I think that a lot of Asian Americans struggle with kind of and not to say I don't struggle with this still, right? Like imposter syndrome and like
Sure, yeah.
timidity. I think that that is something that we can all grow in, but also I think that can also be used as a strength, right? Like listening first. Like you don't have to be bombastic all the time. I think this personal strength of mine is wanting to, which is useful in both the Asian healthcare thing, but also in innovation, is to kind of listen, right? I think like be quiet first and then be able to be confident in what you're speaking to. So it's a kind of that mix of like listening, being quiet, but not in like a timid way, but being quiet for a purpose, and then taking action when you need to take action.
Yeah,
So just want to
absolutely.
encourage folks. Yeah.
Yeah, no, I mean, super encouraging. And thank you for sharing. I feel like all of the advice that you just gave is really sound advice for anyone interested in this field. And just like your tip on relationships, too. Like, I mean, yeah, I think don't burn any bridges and like,
Yeah.
make sure, that you have relationships that are meaningful, not just like to, not for like superficial, like, I want to get somewhere, use you somehow. But I think having meaningful relationships. I think even your mentor, right, that got you this, your boss, your current boss, you know, like I'm sure he didn't feel like it was just like you wanted him for something. I'm sure there was relationship built. So
Yeah.
Eddie, thank you so much. I'm so sorry. Before we end our time together, I'm curious, is there something that you don't like about your job?
Yeah. Well, I would say this. Innovation in general is a pretty sometimes nebulous field, right? Both to laymen, to your point, Blair. I love the questions that you asked to actually tangibly understand what I do, because I think even in healthcare, innovation can be seen as a lot of different realms, and with that comes challenges in that not everyone who might approach us like knows exactly kind of the way to do things in a way that's like relative to the healthcare system. So I think it can be a little frustrating to like navigate that sometimes, but that's like a growing process. And through that
Mm,
comes kind of my role as program manager to, um, think about how we lessen that burden. I would also say working in healthcare can be frustrating because healthcare is kind of slow to change. Um, it's a lot of bureaucracy sometimes, for better or for worse. I think a lot of that is around kind of the safety sensitivity around patient data and stuff like that. But also, you can look at the way medical training is. It's very kind of archaic, where it's like, the attending teaches the resident. And so I would say that that can be frustrating sometimes, like a lot of
Mm,
red tape,
right.
that maybe my friends in tech don't deal with, right?
Hmm. Hmm.
And so that's general health administration. But to that point, always being able to look back and thinking about, okay, yes, this was like really a pain to get through all this red tape, but now hopefully we impacted some lives is always
Sure.
is always good.
Yeah. Yeah. Well, thank you again for being so transparent in all of my questioning. I really appreciate it. Are you open to communicating or connecting with somebody that maybe has more questions about what you do?
Oh yeah, happy to. You can reach out to me on usually LinkedIn. I don't know how else people reach out to folks, but obviously I have a cell phone and things. But yeah, happy to connect. I mean, that is the driving reason why we created our Asian healthcare group.
Yeah.
But also, I mean, happy to connect with anyone. I mean, people refer their friends over, or they whatever it is. Yeah.
Yeah, no, I'm definitely because now you're the only person I know in
Okay.
this
Yeah.
industry. So
Please.
if there's anyone that is interested in healthcare administration and has questions, hit me up through social media. You can DM me or you can email me at podcastwigu@gmail.com, and I'll connect you to the only person that I know knows what he's talking about, and that's Eddie Lai. So thank you again, Eddie. I really appreciate your time today.
Of course. Thank you so much, Blair.
Awesome. Until next time, guys. Bye.